everyone, I am Koyuri May Emisidro, and today we are going to perform the catheterization for male and female patient. So this procedure aims to safely introduce the catheter into the patient's bladder as well as to promote urine drainage. So this procedure needs to undergo steps such as the assessment, planning, implementation, and evaluation. For the assessment, you need to assess your patient's condition. Several questions will be asked that will be beneficial for the procedure. And then for the planning, you need to assemble all of the equipments that are to be used. So you need to have a sterile catheterization tray wherein it includes the sterile gloves, sterile drape, lubricant, antiseptic solution, indwelling or straight catheter, pre-filled syringe, peri-light, and then you also need to have a urine container or specimen container, urine bag with drainage. You also need to have disposable bags or disposable bags, as well as you also need to have your waterproof linen pad. So after that, we will now proceed on the implementation. For the implementation, first is you need to check your doctor's order for the request of catheterization for both male and female patient. So for our patient, the patient needs catheterization. So we will perform catheterization using indwelling Foley catheter. So after that, you need to establish rapport. You need to introduce yourself to your patient, verify your patient's identity, and explain to your patient why do we need to conduct this procedure and on how they can cooperate throughout the procedure. So, good day ma'am. I am Koyuri May Emisidro po, and I will be the one po who will gonna perform the catheterization po. So, to verify your identity ma'am, can I ask for your name? Yes po, Ma'am Ayana. Also, can I look at your wristlet? So, Ma'am, it states here po that your name is Ayana Naku, sex female, bed number 3, date po, or birth date po is January 1, 1998. Is that true po, Ma'am? Okay po. So, catheterization will be performed po with the aim po to safely insert the catheter in your bladder po. So, this will be beneficial po for you because when the catheter is already inserted in your bladder po, it will promote urine drainage po. So, a little discomfort will be felt on this procedure po. So, just tell us po when you can't handle the discomfort anymore po. Also, ma'am, before we start, may I ask po if you have an iodine allergy? Wala po. How about latex po? Wala naman po. So, that's good po, ma'am. So, we can now proceed po on the procedure. Is that okay with you po? Okay po. So, after that, you need to provide your patient's privacy by closing the doors and the curtains so that your client will be more comfortable and secured as you perform the procedure. And then, you also need to perform hand hygiene technique or any infection control technique to prevent the cross-contamination between the nurse and the patient. Also, we need to have an adequate lighting for better visualization when we are inserting the catheter. And then, now is the time for us to prepare our patient. So, we will expose the genital area of the patient before we render perineal flushing. So, first is we will clean the perineum of our patient. So, ma'am, we will clean your perineum area na po. So, we will use a warm water with washcloth to clean the perineum area of the patient. So, we will use different areas or quarters of the cloth for the different areas or parts of the patient's perineal area. So, we will make sure to follow the rule of 7 or the cleanest to dirtiest rule, wherein we will clean the perineal area of the patient from the farthest area from us onto the near area and then the middle. So, make sure to clean the genital area of the patient going to the rectum. So, after performing the perineal care to the patient, we will now position our patient. So, in here, we will position our patient. For female patient, we will position them into a dorsal recumbent position wherein knees must be slightly flexed and then 2 feet apart. For male patient, we need to position them into a supine position. So, we will now position our patient, and then after positioning our patient, we can provide drapes for additional privacy and comfort to our patient. So, we will cover the other areas that will not be assessed. So, after positioning our patient, we will now open the sterile catheterization tray. So, we will open the sterile catheterization tray, and then we need to use forceps to open the sterile catheterization tray to make sure that we are performing the sterile technique. So, we will open it using the forceps. And then, we need to make sure that after opening it, we can now put on gloves if there are available. And then, we will put on the sterile drape onto our patient. So, after putting on the sterile drape on the patient, now is the time for us to open other equipments that are on the sterile catheterization tray. So, assume that we've already opened the Foley catheter. We will now test the balloon. So, we are using a indwelling catheter. So, we will insert a pre-filled syringe on the injection part of the catheter, and then we will insert appropriate amount of water. And when the balloon inflates, so assume that the balloon already inflates, we will now withdraw the water and leave the attached syringe on the injection port. So, after that, we can now open the specimen container if there are other specimens to be withdrawn, so or to be removed from the container. So after that, we will now lubricate the tip of the container. So after lubricating it, we will put antiseptic solutions on the cotton balls. And then, we can now put the tray between the patient's hips, or legs, rather. So, after that, we can now perform the insertion of the catheterization. So, for the female patient, we need to separate the labia minora and majora of the patient to find the meatus. So, in here, we will use the cotton balls to clean the labia minora and majora of the patient, as well as the fold. So, we will clean the area that is far from us, and then dispose, and then get a new one to clean the area that is near to us, and then dispose, and then use or get another cotton balls with antiseptic solution to clean the middle area, and then dispose. Make sure to follow the rule of 7 and then in a singular motion. So, after cleaning the perineal area of the patient, now is the time for us to insert the catheter onto the patient's meatus. So, we will separate the labia by the use of our non-dominant hand, and we will insert the catheter onto our patient's meatus. So, when there are any, or when resistance is present, ask your patient to inhale deeply and then rotate the catheter. And then rotate the catheter. So, ma'am, inhale deeply po, and I will rotate the catheter po. Okay, that's good po, ma'am. Okay, so for our male patient, assume that we've already finished the female patient. Now we will proceed on administering the catheterization for male patients. So, again, by the use of our catheter, we will lubricate it. And then, after lubricating it, we need to clean the penis of our patient. So, we will hold it. And then, we will clean it. So, for uncircumcised patients, make sure to retract the skin and clean the penis. And then, dispose. Going to the glans penis. Then, dispose. And then, going to the base. So, after cleaning it, you need to hold it with a firm pressure and then inject approximately 10 ml of lubricant onto the patient's ureter. And then, after that, you can now insert approximately 15 to 20 inches of the catheter tip on the patient's meatus. And then, make sure not to use forceps on inserting the catheter. And then, if resistance is present, make sure to rotate the catheter. So, resistance is not present on our patient. So, after that, since we are using indwelling Foley catheter, we need now to inflate the balloon. So, we will put approximate amount of the pre-filled syringe onto the balloon, depending on the manufacturing label. Or in here, we will use 15 ml, or 5 ml rather. So we will put approximate amount, and then when the balloon already inflates, make sure to tag it securely if it is already placed. And then after that, you need to secure the placement of the catheter onto your patient's hips by putting velcros or tapes, but make sure to provide slugs for movement. And then after that, we will check the drainage bag if there are kinks, and then if there are not, we will hang it onto the bed of the patient. So after hanging it, we will now perform aftercare on the patient. So we will now remove the drapes. And then after removing the drape, we will now perform aftercare on all of the equipments that are used. So we will return them on their proper placement, and then we will provide comfort to our patient by putting some cover on our patient. So, sir, are you comfortable in your position na po? Okay po, sir. So, after that, we will now proceed on the aftercare for all of the equipments, and then our patient is already comfortable. So, now we can proceed on the documentation. So, for the evaluation, we need to document all of the important findings in our patient. So, we need to document the time of catheterization, the amount of the urine that is collected, the characteristics of the urine, the reaction of the patient, and then if there are any resistance found, we will also document it. And then we also need to report abnormal findings on the appropriate person. So, that ends the catheterization for male and female patient.